Hi Erin, it's Galen. Doing the online stuff because, COVID. I don't have a partner today because I am under quarantine from being exposed potentially to someone who had COVID. So, yeah, I'm just going to talk about what I would do if I had a real person with me. So, we're going to be talking about the functional movement screens and the postural assessments. I will start with the functional movement screen, which is 7 tests that are your balance, mobility, and stability, and they are here to determine your deficiencies in these movements and your basic competency doing movements as well. So squats, lunges, the ab work, shoulder mobility, etc. So what I will start with is the shoulder mobility score. You're going to be measuring from the most, like the ring finger, or the middle finger rather, in the most distal crease, which is right here for me. Depending on that length, that determines what score they get. So if you get a 3, your 2 fists behind your back are going to be within 1 hand width of each other. So if you're 19 centimeters even or a little bit over, like a little bit more flexible, that's a 3. Number 2 on that scoring is a hand width and a half, and then anything more than that is a 1. You get scored 0 if you cannot do it at all because there's pain, because it's an insufficient test and you can't do it. You shouldn't be marked for something that you can't do. It would be a 0, yes, I said that. Clearance test, it would be touching your opposite hand to your opposite shoulder, raising the elbow, seeing if there's any pain. If they can do that, then they would do the shoulder mobility first. The second test I'm going to be talking about is the active leg raise. So you're going to have the body of the case for the instruments underneath the knees, and then you're going to take out the ruler stick portion of the FMS kit and put it between the kneecap, so the patella, and the ASIS, finding the medium between, or the middle between the two, and then you're going to put that there, and that's where your measurements would come from. So the person, if they could pass that medium mark, so bringing their hip up into full extension or flexion, and your leg is in full extension with a plantar or dorsiflexed foot, you would be getting a 3 from that, so your leg's straight up in the air. If they get a 2 if it's between the knee and the ankle joint, and then they get a 1 if it doesn't even pass the knee. They don't get any marks, so they get a 0 if there's a pain associated with that test. You would do all of these tests 3 times, depending on if they're doing limbs. So 3 on each side, 3 on that side, 3 on the left, 3 on the right. Then that would be your raw scores, and the final scoring is taking the worst out of each raw score. So say you got a 1 on the left and you got a 3 on the right. Consistently, you would pick the 1 and then the 3, and that would be their final score. How you would give that to them is the compliment sandwich. It's like, oh, you were able to finish the test, but I am noticing some deficiencies from your left and your right side. So we'll work on balance and strengthening isometric or bilateral movements. We'll do a one-legged leg press to increase the strength on your left side because we've seen that it was weak, or bilateral curls or shoulder presses for the shoulder, or just mobility work, because that is more mobility than it is strength. But we would work on what we would be able to do and see, making it tuned to more one side than the other. Do some passive and active stretching to get both legs and both arms into the same range of movement, because everyone has a dominant side, so it's normal. And yeah. Okay, and now we're going to be talking about the postural assessment. So from the front and the back, it's a straight line through the midline, so using this sternum as a landmark, going all the way down, making sure everything's even, and then the spine in the back. Side landmarks would be the ear, so the inner processes of the ear, going down to the acromion process, or the most boniest landmark in the shoulder. You're going to be seeing that in the hip between the, I think it's the posterior. There's like the meaty part right here, the posterior, like ASIS, and the iliac crest. I know this. And you'll be using the, I forget what it's called. The most boniest part, like the most you can see boniest part of the ankle, starts with an M. I don't remember what you called it, but that's where you would be using the landmark and the side of the, like the central part of the knee. So in between the back and the front, like where your patella is seen, and where the back of your knee is. So I'd be using for that part of the landmark. Thank you. You'll also be noting when they're viewing from the side if they have the ideal spinal curve. So a nice gentle curve in the lower lumbar, coming into a slight S, following the thoracic and the cervical spine. Anything going too far forward or too far back puts them in kyphosis or lumbar lordosis. So that's something you would be noting in your postural assessment. And the reason why we do postural assessments is to see if there's any deficiencies, any imbalances, just anything that could be changed in fitness. Not everything can be changed in fitness, obviously. If they have spinal sclerosis, the S or C curve in the spine, it's not always like muscular, but if there's some things that can be done to fix it, like just doing some chest opening exercises, making them back stronger, that can, if doctors are okay with it, that's something we'd be able to do for them. This just helps, and it shows it's like a baseline. So they come in and they have like kyphosis and they're like this, hunched over. Like you'll be able to slowly exercise their body out, so they might not be like as hunched. Like they'll be a little bit like this, but still have the kyphosis, but you can gradually make them straighter again if it's just like constant everyday going to your laptop, your phone, all that stuff. Depending on if they have any bone problems, obviously, if they have osteoporosis, it might just be like stuck like that. Like you can't really fix it unless you get surgery, but you can lessen the pain that comes with like a constant hunch by just strengthening the muscles around the spine. Eventually it'll fix its posture, but we're just trying to do this so they can see where they're at posturally wise, and then maybe be able to program around their posture so we can strengthen the muscles that we see that are most weak. And this is the end of my presentation video. I'm hoping this covered all the points. Stay safe, stay healthy, wash your hands. Yeah, bye. Postscript. I realized that some people in postural assessments like to pull back their posture or their shoulders to seem like they're doing good postural, just at everyday activity or like sitting. So you would have them march in place for like maybe a minute or jump up and down for a couple of times, and then wherever they naturally land is where we would measure, because then they're distracted by all the exercise that you kind of made them do. So they're giving you a true reading, and having a true reading helps us build upon their program. So yeah, bye for real this time.